I'm joined today by a few of my colleagues from our team. We hope the insights we shared last week and today are valuable to you. If you have any additional questions, feel free to reach out to me. My contact information is on the slide. So again, good afternoon. Welcome back for those who have joined us through all our different series, or if you're new to this one, we appreciate you joining us. We are thrilled to present this four-part webinar series in partnership with the Montana Department of Public and Health and Human Services. 0 to 5 Montana is honored to serve as the grant administrator for the employer-sponsored child care grant, which has been made possible through a contract with the DPHHS Bright Futures Birth to 5 program. What to expect today? This marks the final session of our four-part series designed to guide you through the eligible child care strategies highlighted in the grant application, which opened on July 18th. Our objectives are twofold for these series. First, to empower Montana employers with practical knowledge and tools to create and implement childcare solutions tailored to their workforce needs, and to equip employers with the necessary information to successfully apply for the employer-sponsored childcare grant. Today, we will explore reserving childcare slots, priority waitlists, and backup care. Following the presentation, we will allocate at least 20 minutes for question and answers. The last few sessions, we've had more, so we encourage you to either put your questions in chat or when we conclude to come off mute and ask those questions. Today's session will be recorded and later posted on the Family Forward Montana website. And again, like I said, we encourage you to either share your questions through chat or be prepared to ask those at the end. And if we are unable to answer any of those questions during our session, we will compile them in an FAQ document that'll be published on our website after the webinar series concludes. And also, we're using the FAQ to provide any clarification to questions that may have been asked or pending through prior webinars. So just a little bit about 0 to 5 Montana. In case you aren't familiar with our organization, we are a statewide early childhood organization focused on increasing access to early care and education, supporting and strengthening families, and empowering our business communities. We have various key initiatives. Some of the key ones are there at the bottom, as well as our website to learn more about it, and one of which is Family Forward Montana. Family Forward Montana's initiative founded on the principle that the well-being of employees and their families is integral to the success of businesses and Montana's economy. Through our Family Forward Montana initiative, family-friendly policies and practices such as child care benefits are promoted in order to improve employee engagement, reduce absenteeism, and strengthen your talent pipeline. Just wanted to share again an overview of the grant. The applications are being accepted now and closes on August 24th at 9:00 p.m. Mountain Time. We encourage you to review all the information provided on the Family Forward Montana website related to the grant, and an updated FAQ has been posted under the additional information on the grant application site. All these resources provided will help you in preparation of your application. The period of performance for this grant starts October 1st, 2025, and ends on September 30th, 2026. I wanted to share some information. This data comes from the 2025 Society for Human Resources Management Employee Benefits Survey. It is one of the longest running national benefits surveys conducted annually since 1996. And these are answers actually coming from the employer perspective. It reflects the percentages of employers who rated each benefit category as either very important or extremely important. When you view this through a family-friendly workplace lens, family-friendly benefits, which is right here, ranked fourth just behind health benefits, leave policies, and flexible work options, all of which those categories supports families and also promoted as family-friendly policies and practices. Within the family-friendly benefits category on this survey, Montana employers identified dependent care flex savings account and emergency backup care as the two most important childcare strategies. Montana faces major childcare access challenges. This webinar hopes to help you explore 3 scalable strategies to support your workforce through employer-sponsored childcare. Before we dive into the 3 remaining childcare strategies, let's take a moment to review some universal factors that apply to any of the strategy you choose. Know your workforce. Start with your employees. Your strategy should reflect their needs and feedback, otherwise it won't land. Secure leadership buy-in. Every successful strategy has a champion. Ideally, that's someone at the top, your CEO, COO, or your chief HR officer. When leadership is actively involved, others will follow. Focus on measurable return on investments. Your strategy should deliver clear business value. We'll walk through some tools to help you estimate and track return on investment. And communicate the benefit. Once you're ready to roll out a strategy, develop a clear, engaging communication plan for the employees. A benefit can't make an impact if no one knows it exists or how to access it. And you'll want to lean on partnerships, especially for the 3 strategies we're about to cover. Collaboration is essential. The right partner can help you build and sustain your efforts. These considerations are foundational, whether you go with priority waitlist, reserve slots, or another strategy. Thinking through these points up front can make or break your success. You don't have to do it alone. Many businesses have found that strong partnerships, both internal and external, are what keeps strategies sustainable and effective. And just wanted to go over a disclaimer before we get into these childcare strategies. These presentations is not legal advice. We encourage employers to consult with ERISA counsel, benefits advisors, any company attorneys, and tax professionals for advice. So the 3 categories, strategies that we'll explore, we'll look at the definition, the benefits of it, and the pros and cons. These strategies are compared not only to each other, but also to the costs associated with a near-site or on-site childcare option. And you'll also possibly see these strategies integrated with another strategy like the community infrastructure investment. In that case, it may focus on partnerships with a segment of providers that are able to meet the desirable goal of this specific strategy. So we'll start off with reserving slots. And you'll see the definition there that is pulled out of our guide. Employers may partner with local programs to reserve seats for exclusive access by priority employee groups. This is ideal in areas with limited supply. You reserve specific slots for your employees at childcare programs. It guarantees them full-time care access. It alleviates challenges for employees finding care. To have a comprehensive understanding of what this process entails, on our Family Forward website, a toolkit was developed, and it actually was developed by Shelby I place a QR code there because it will take you right to that toolkit. I think it gives you a really great perspective of what employees will encounter. And so that's the advantage of when you're looking at reserving slots. It's also a high retention impact. And then an employer provider contract is required. So you are reserving slots for your employees at either one or multiple providers. And so the advantages there is if you have an employee that potentially is participating at part-time and you have an open slot, and as far as a need for full-time, but the reason they're participating part-time is because of childcare access issues, this is a great opportunity to be able to provide that option and then bring that employee at a full-time capacity. It's also a great tool for when you're recruiting a new employee into your organization. So here's some pros and cons of reserving slots. It is a high impact strategy for employers that with critical staff facing unmet childcare needs. It may be best suited for first responders that you're recruiting, healthcare professionals like nurses, technicians and skilled laborers, managers, or shift supervisors. These are positions that you want to recruit them especially, but one of the things that may be deterring them from joining your organization is childcare options. And so having this as maybe the pivotal thing to having them sign that offer letter and even relocate. For reserving slots, this is a list of allowable expenses for reserving slots that can be funded under the employer-sponsored child care grant. And I did put a QR code there as well, so it takes you right to that guide. This may not cover all the costs associated with implementing the strategy, as well as all the other strategies. The allowable expenses may not cover all the costs. So just a reminder, review the allowable expenses guide before submitting your grant application. You may need to pair grant funds with other investments or funding sources if needed. And next, we'll go into priority wait list. It's an alternative to on-site childcare. Employers may partner with local childcare programs to establish priority access for employees at specified programs. In this model, childcare programs offer wait lists and placement services to employers. This is a lower cost strategy in comparison to reserving slots or an on-site, near-site childcare run by an employer. But it also shows that you want to support your employees' access to childcare without the investment of those other options. And this allows for faster placement for employees. So if you have an agreement with certain childcare providers, your group of employees would rise to the top on the wait list versus maybe somebody who is individually being placed on the wait list. Here's the pros and cons of establishing a priority waitlist partner. It is lower cost, improves access, enhances employee satisfaction. There is flexibility to partner with multiple licensed childcare providers because of the investment on the employer side will be less in reserving slots. The cons are there's no guarantee. It is a wait list, so it is dependent on availability and capacity. And you have limited control. And then some of the providers may not be considered near site to your working location. But this is a meaningful benefit that signals, again, that you care, yet less of an investment than reserving slots or on-site, near-site childcare. Here are the allowable expenses for establishing a priority waitlist partner. And then finally, backup care. Backup care is when employers provide backup care services for employees through partnerships with local childcare and out of school time partners. Typically, employees receive a certain number of days or credits for use in approved partner programs in the case of emergency or short-term coverage needs. And you'll see there, this is used for on-demand emergency childcare, covers for school closures, illness. You see a lot of this type of structure or program being provided through vendors like Bright Horizon, Cure.com, who have national presence, but it doesn't prohibit to having that kind of relationship at the local level. And if you think about it on averages, according to research by Cure.com, businesses may gain back or don't lose 20 annual hours when providing backup care. So this addresses unpredictable care gaps that lead to unplanned absences, common causes, school closures, holidays, in-service days, a sick child or sick provider, last-minute caregiver cancellations. And I looked at the Helena School District calendar, and it looks like they have about 25 plus days a year of possible closures. This excludes any kind of early releases. So if you think about this, that in providing backup care, it helps those pieces of your employees either not being available or even using their vacation time to cover because they don't have care. And this is a cost-efficient strategy that builds trust with employees and directly reduces absenteeism caused by childcare, lack of childcare disruptions. Pros and cons. Pros, again, it reduces absenteeism. It's flexible and scalable based on the employer's program. It's immediate relief for employees. The cons of this, it is variable. It really is dependent on finding providers that are willing to participate in a backup care situation. And it also, under a backup care option, it is a limited number of days that an employer customarily would provide for that. So an example of this would be if you provided 8 backup care days, and you would basically for that potentially either reimburse directly to a provider that you're contracted with, or in some situations, employers will reimburse an employee if it's a eligible expense of like let's say $150 a day with a maximum of 5 days per employee. So when you're looking at what is that cost, that's kind of a structure that businesses have used in order to provide backup care. And these are the allowable expenses if you're looking to provide backup care options. So when we look at all these strategies, there is no one size fits all solution. You want to choose strategies based on your workforce size and structure, their geographic access to providers, what is your HR and retention goals, what's your budget and available funding. You might layer multiple strategies, for example, childcare tuition stipends or priority wait lists plus backup care for maximum impact. Think about what your employees need and what problems you're trying to solve, whether that's recruiting talent, improving attendance, or supporting retention. And I wanted to share this slide again, what I shared in the first webinar. As I shared then early in my leadership journey, someone shared this simple but powerful insight. Choosing not to act is still making a choice. As we conclude this last webinar, it's clear that inaction has a cost when facing recruitment and retention challenges. And I wanted to share a couple of examples as far as how would you calculate the cost of absenteeism. This is included in Epic Colorado's Employer Navigator financial worksheet on page 5. Down below here is a QR code to access that, but this is a clip as far as how you could go about costing out what absenteeism costs your organization. And on that same page, here's a cost calculator on the cost of turnover and replacement. So next steps, even when starting small, learn fast. Leverage the potential for seed funding that the employer-sponsored child care grant may offer. Look into tax incentives. Now's the time to invest in sustainable child care strategies. And we at 0 to 5 have multiple resources through our Family Forward and our Business Connect initiatives. We really encourage you to research and look at all the different resources, or even just reach out to myself and Shelby and Jason to support you through this journey. Whether you're just beginning or already in deep planning, we have the resources to support you for success. And with that, any questions?
Lena, this is Jennifer, and I have a question about substitute pools. So I'm not sure if this falls under this category in terms of like backup support or whether it's more of a community infrastructure system change. But our employers in our community are looking at a way to help ensure the availability of consistent care. And we have a lot of childcares in our area who are closing sporadically because the employee has a doctor's appointment or they're sick that day or they're on vacation or whatever it may be. So could this look at a way to create a substitute pool and help with some training of substitutes, recruitment, maybe some stipends, graduated stipends once they've completed X number of assignments?
So it sounds like, and correct me if I'm understanding this wrong, sounds like you're wanting to set up a child care provider pool to meet those gaps. Is that right?
Right.
Okay.
Because the employers are having the challenge of employees calling out because their childcare
Mm-hmm.
has closed for whatever random reason it may be.
Right.
But we have about one substitute in town that everybody shares. So
Mm-hmm.
they're struggling, to say the least, to find substitutes. So if we could help build up that pool, um, to decrease
Mm-hmm.
absenteeism, and then over time, look at a way to make that more sustainable on its own, but use this grant to start that process.
My first thought on it wouldn't necessarily be eligible for the childcare workforce. However, if you had a program, so of backup care, it would have to be contracted providers agreeing to be that backup care. So it's kind of a flip of, and I know you have to have those resources to be able to provide that backup care.
Yeah, I think that's where we are, is that we're not
Yeah.
even into that point where the backup care is available
Mm-hmm.
because we're still struggling with the consistent care.
Mm-hmm.
And
Yeah,
so we're taking that, one step, going backwards, even one step further to the very
yeah,
beginning of needing to create consistent care and helping to do more of a systematic approach in the community as a whole for
right.
a consortium of employers to benefit from.
Yeah,
And maybe
let
backup
me,
care is the wrong word. Is that more of
yeah,
like
no,
a community
no, I mean,
infrastructure investment where we're investing in the backbone of the infrastructure of
mhm,
childcare in our community needs to be available workers, right? And
right.
we're struggling with that part.
Yeah, I'd have to think a little more on that and review the allowable expenses, Jennifer. I can explore that a little bit further. I totally understand what you're saying, um, but I'll have to really look into it a little bit further regarding the parameters of this grant and our contract of what's allowable.
Okay, maybe we can
Yeah,
set up a time to follow up on that
yeah,
because, I these grants are wonderful. By all means, they're amazing, but we don't just want to band-aid the situation for the time period of the grant. We want to look at bigger systematic
absolutely.
changes that we can implement so that when the grant period's over, obviously, there's some long-term impact there. So
Yeah,
that's
absolutely.
that's one of the major areas we've
Mm,
identified as a barrier to care is, a consistent workforce.
yeah, and it is. I mean, and that's why I say that this is like really we encourage employers to look at it as a seed funding because it should help to jumpstart a benefit to your employees, right? And the last
Right.
thing you want to do is to take away something after a year.
Right.
Um, so yeah, it definitely is something where being thoughtful about how you can sustain it is an important aspect, even prior to completing the grant, because a year will fly by pretty quickly, especially when you're planning something rather extensive and to impact a systems change. But
Sure.
let me look into that further, Jennifer, and then maybe we can connect by like mid next week. That gives me a little bit of time to explore it. Plus, probably may need to reach out to the state as well.
Okay, sounds good. Thank you.
Thanks. Any other questions? And maybe not regarding this, maybe from some of the other strategies that we've already talked about. Any questions on those? Oh, do you have a question, Tobias?
No, not so much a question. I was just going to say that, after listening to your presentations over the 4 days, I just need to go back with the slideshows, go back through the information with my um, supervisor and see it's a lot to unfold. Where do you want to go? I know that we've got some benefit program already with kind of like the savings account, but we're not doing any type of match or anything to it.
Mm-hmm.
And I think that's probably the most natural step. We've got clinics spread out over probably close to 40, well, yeah, close to 40 miles, 30 miles at least. So, some of the other options wouldn't be real feasible because it wouldn't help all of our employees,
Mm-hmm. Right.
something like that. But yeah, just thank you for taking the time to do that so we have the information and we can dig through it. Of course, being August 5th, and we've got to the 24th, time gets kind of short to decide what and if we want to do. So, but yeah, we have just a little bit of information to dig through. So thank you.
Yeah, and if you have any follow-up or anything like that, we can help support you. Don't hesitate.
Thank you.
All right. Well, again, on our Family Forward website, right at the top, you'll see it'll take you to the grant application information. Encourage you to look at all the different resources we have available. That's not only limited there. Everyone on our team that can help support you in this process is available. Just don't hesitate to reach out. And again, thank you for everyone that has joined us today, as well as the last 4 series. We appreciate it. And we encourage you all, I mean, take a small step, but learn fast. So that's all we can ask, right? Thank you, everyone.